our health center at Buwambo, in case a youth comes in, we always have our champions at the facility. We have always those who are based in the community and those who are based at the facility, whereby if a community peer sends us someone, then the peer at the facility always receives. They will always communicate on phone calls. And when the youth peer receives, they can always go through the first session, counseling, that first audience, ice breaking, which this youth may not be able to break to the health worker because of that fear. And we always have a youth corner where we gather our youths to come and have our services delivered to them in privacy and in a friendly manner. So what we always do, we interact with them, open up, share with them. And in case it needs medical intervention, we always do. I myself, I offer the service. And in case I find that it's beyond my coverage, I always refer to my doctors. And then from there, we always have HIV testing and counseling services. The youth himself or herself, we always have 2 of them, the youth, a male and a female. They always engage with them. Some come without an idea of even testing, but with what they share, they come up to choose to test. And then when they test, we don't always finish up the journey alone. We engage the counselor. The counselor comes in, we always tell them that this is our youth, please provide for us some more time. They talk to them, they give the results. And in case the youth turns out to be the other side of the positive, still in my art clinic, there is that youth representative who takes on the responsibility, reminding this youth, when a youth come back, how are you supposed to take the medicine? Please pick up the courage, all that package. The youth counselor does that. Then in case this person is okay, we always still encourage them to keep safe. And then from there, we always have the family planning services offered from the youth corner. We don't refer this youth to the other departments of maternity or the inpatient. We always offer the service within our youth corner because we have the beds, the coaches, and the facilities. By then, we used to have the supplies, but now we are running short of the supplies. So I think SLAM will help us to cover up the gaps in that, because these people really need them. And at times when they come, NMS hasn't yet supplied. It supplies once in a quarter. And then you don't tell them that, you know what, we are still waiting for the government to bring. So as SLAM, I beg you people, please come into that, and we see our youth not getting unwanted pregnancies, because we see Wakiso is always at the highest rate, 24%. That's a big percentage. So we are looking at how can we still step down this by availing the services. Not us to be there, but without what to use. We need to be there with what to use. And with what we have always done health education. This is more under SRHR. Most of our youth never knew that this candida thing, currents come because of how they misbehave in the bathrooms and the toilets. But those who have got a chance to listen to us, they've come back appreciating. They tell you know what, I never knew. I used to treat these things, I treat and treat, but nothing could change. But because of the interaction we have with them, our youth were always engaging with them. They came up to appreciate, and they are really happy for the service. So dialogues have been so much key at our facility.